honor and privilege. Thank you, Varna. Uh, I would like to thank, first of all, I would like to thank you and Barnali because they wanted me to, I mean, for giving me this opportunity. This is, of course, as you rightly say, that this is my passion to kind of spread awareness about women's health at every sector. You know, the needs are different. The awareness has to be hence different, and at every sector, the awareness is something which is even in the very educated societies very limited. What my experience is that in you might be a great banker, but as when your health is concerned, you actually very limited in the knowledge and in the awareness. So hence today I'm going to just take you through different age groups and the challenges that each age group faces, and whether or when it needs to be uh, like addressed. Okay, and how it needs to be addressed at a very, it's just a 20 minutes presentation, maybe it'll go up to 25 minutes, but I have quite a few age groups to cover. That's why my talk would more superficially, like touching upon the problems and touching upon the aspects rather than going deep into it. If anybody wants to kind of share, ask anything more, you can ask in the chat box, or we can have a dedicated session on that particular thing later on. Yeah.
Yeah, so
So
thank you so
should I?
much, Doctor. You're starting to share your presentation. Please go ahead with that. This is
Okay.
for all the participants. I would request all of you to use the chat box option. If you look at your screen, there's a small box which says chat. You have any comment, any query, any question, please keep typing it. It's my responsibility to address that and present it to Dr. Sudeshna Ray. But at the end of a presentation, otherwise we will be extremely challenged for time. And in case you have any other issues, you can just message me on WhatsApp, and I will try to address that separately. We will let the presentation go on without any interruption, and we will come to all questions and queries at the end. Yeah, thank you so much, everyone. Thank you for joining in. Dr. Ray, please take on.
Yes. So again, a very warm welcome to all my friends and the family there at Bhakti Park, Bengali Association. I think I was talking to Barna that you were doing a wonderful job in getting people connected through these, aspects of workshops and things like that. So today I'm going to talk on health challenges in women across the ages. So I'm going to pick up each age and just going to mention those challenges and a very short overview of how to use them. So I mean, how to overcome them. So this is Suman, 14 years. She started menses 2 years back, and she's now has irregular periods and pain during her periods. A very common thing that you will relate to in this. So the questions that come is, would you worry about the irregularity of periods at 14? You really need not worry about the irregular periods. The mothers out there and the fathers out there, you should be aware that there's nothing much to worry about of irregular period in at 14 years of age, because it takes some time for the entire thing to get kind of matured, for the entire, if you can see this axis, for the entire program to get a little more practice and get into a pattern and get into a proper performance. So it's okay to have irregular periods before about for 3-4 years after you start the periods. What would you do about her pains? Again, pain at this age is a very regular pain because the uterus is congested. The uterus is a new organ to the activity of the uterus is new, and it doesn't know how to behave, and so it kind of goes into a state of spasm when it starts menstruating. You can give, if it's very bad that she has to miss school or she has to miss important activities, you can give a painkiller, but just a little bit of counseling, a little bit of hot water bag, and rest with a lot of fluids helps. When do you really be concerned? If the irregular periods extends beyond 16 years, or if she's gaining too much weight, or if she's having other symptoms, or if the family has a lot of other issues like diabetes, blood pressure, cholesterol, heart problems, and things like that, there you cannot ignore an irregular period, even if it is at 14 years of age. About the pains, when you should really be concerned, really at 14 years you don't have to be concerned about the pain. But if the pain starts before the periods and sometimes stays beyond the periods, is when you should think about visiting a gynecologist about the pain. What should you take care? Nothing, as I said, that it should start from the very childhood. So the healthy lifestyle in form of a healthy diet, exercise. Each child should have some form of exercise what they like. It need not be a very very regimental exercise, but some kind of a play, some kind of a sport, something that makes them more uh, physical activities is very important. So that takes away, that brings us to Mamta. 24 years, married for 6 months, does not want to conceive now. So what should you think about contraception? The most common thing that you think about, the most people think about contraception is if you start taking oral contraceptive pills, or if you start taking any kind of hormonal contraception, then your periods might get irregular, you might not be able to conceive later on. Such are the fears, or such are the myths regarding contraception. So it is very important to have a proper contraception rather than having an unwanted pregnancy, or rather than having a miscarriage. So it is important that you discuss with your gynecologist after a marriage, or even sometimes, when the couples come to us before even marriage, to discuss contraception. And it's very safe to take oral contraception. The only thing that I want to tell you is, if you're already having a problem, the contraceptive will not correct it. As a similar way, if you are not having a problem, it will not cause it. So it is just going to have its effect as long as you're taking the contraception. So once you finish the contraception, you will go back to wherever you were. So it's a good idea to use the contraception if your attitude towards an unwanted pregnancy is something that I cannot have it and I will have to abort for that pregnancy. So you should take a contraception which is more useful, which is more effective. Condoms are not as effective as hormonal contraception. What is the right age to have children? Uh, it's a very difficult question, but right now we say that it's a biological clock. I always tell my women that it's a biological clock. You can't beat that. So it starts from something around 50, matures by 20, and it finishes off by 40, more or less by 40. After 35, it kinds of goes slow. So it's a good idea to consider something between the 20 to the 35. So that's a good idea. That's a good time frame that you can think about. And the right age to, of course, if you think about having a children, later on, how to beat biological clock. So if you want to defer your childbirth, or if you want to defer your pregnancy by beyond 35 or 37, 38, or even beyond 40, you can think about an oocyte storage. This is how eggs are stored. So ovaries, we pick up eggs and we keep them stored in a place where, in a hospital, in a kind of a center, fertility center, where you can use the eggs once you need them later, so that you don't have to worry about preserve the same condition as that. at that age. So it's important to understand that there is an option, but that option also has a limit. So that option, if one wants to take it, it should be taken before 34 years of age. What should she do when she plans to conceive? This is a very important question. This is a very important answer that I want to give you, that there are many things in pregnancy that can be prevented. Going wrong, it can be prevented if you do a preconceptional counseling. So there are in the preconceptional counseling, about 4 months before you actually want to conceive, you can see the doctor, and you don't have to go in for any tests whether you can get pregnant or not. But we assume that you will definitely have a healthy pregnancy, so that we can we can do some tests to see whether you have any, you need any vaccinations, whether you need any kind of supplements before you actually go into pregnancy. So that should be done about 4 months before the the couple wants to get pregnant. So Neha, 32 years, married for 5 years, and now she's trying to have a child. So how can she go ahead? If she has really tried her, about a year of unprotected intercourse, and she is aware that these are the times when I can conceive, and if she has really tried for about a year and she has not succeeded, then it is time that she should say that, okay, I need some kind of help. So can they have a difficult? What are the chances? If you see this graph, there is the infertility. If you see the causes of somebody not being pregnant, if you discuss it at about 100%, the female factors are about 30%, the male factor is 30%. So they are equally responsible. It can be equally responsible for it. 20% can be unexplained fertility, and these are mixed. So they can be combined, they can be mixed, there can be other factors. So there is definitely if somebody has really worked hard towards having a family for 5 years and they are not conceiving, they will definitely, Neha, here would need some help in getting the pregnancy. So the help can be in form of, there are stages of helps. So the help can be in form of some kind of medications, or medication plus injections, or medication injections, and an artificial method of reproduction, with such as an IUI, which is just injecting the sperm into the female uterus and increasing the chances of fertilization. Or it can be IVF. There are stages which need to be followed, and each stage takes roughly about 6 months time. So by the time one realizes that she needs an IVF is about almost 1.5 to 2 years after she has started the first stage. How can they plan for treatment? They should go to a gynecologist or to a fertility specialist, and then start, as I said, that the planning need that can be done for you. For Neha, it can be different. For Suman, it can be different. For Mamta, it can be different. So that needs to be spoken about when you come across a fertility specialist. And then the roadmap has to be laid down, that if plan A fails, then what is the plan B? If plan B fails, then what is the plan C? So these are things which needs to be discussed. So Janvi, 42 years, married for 18 years, 2 children, son and daughter. She's otherwise healthy, but she has minor issues. What kind of minor issues? Troubled by recurrent urinary tract infections. How can she really prevent them? So these recurrent urinary tract infections can happen with age, especially it can happen in a young age also, but the recurrent urinary tract infections are a very common thing around 40s. One, because you're busy and not taking care of your lifestyle, and two, it's because there are some hormonal changes which makes episode of such an infection, and she pops in the same pill. That's something which she should avoid, because every time the bacteria can be different, every time the bug which is causing the infection can be different. So it is very important that she does the urine test and a urine culture, because at one point of time, it's a very common thing that we are seeing nowadays, that they are having infections, they are going on popping in the same pills, and by the end of 1 year, so 3 4 times of popping the same pill, we see that she's not responding to any oral antibiotic. So this and then we have to give them injectable antibiotic. This is something which one should avoid, because if you take any antibiotic, it will work for some time, but it will not take care of the infection completely. So it is hence mandatory for us to almost recognize the bug every time we give an antibiotic. And of course, the lifestyle measures of having enough water, of being like at regular intervals, to keep an alarm. So people who are having regular urinary tract and recurrent urinary tract infections, we see that you kind of have two alarms, one to drink water and one to go to the toilet and pee, because it is both, if you don't drink enough water or if you keep the urine stagnant in the bladder for a long period of time, they can lead to urinary tract infections frequently. Sometimes a period is very heavy. Does she really need to see a doctor? Most of the times, of course, she needs to see a doctor. Most of the times, heavy bleeding during periods at around 42, it can be attributed to a perimenopausal thing. So it can be like around the menopause, which can continue for 3 4 years before she actually go into menopause. But most of the times it is just a hormonal imbalance, and so if it is very infrequent, then we don't even need to give any medications. If it is very frequently happening, then we can give her some kind of medications which she needs to take about 3 to 4 months, and then that should be most of the times this can be taken care of. However, it is very important that she really needs to see a doctor and doesn't think that, oh, I'm having heavy periods and it's very natural. Especially Dr. Ray also told us that it's okay to have heavy periods around the menopause. But sometimes, because 10% of the cases, there can be some difficulties which can lead to a problem later on. So it is important to find the doctor's expertise will tell you, will guide you to take that kind of path, to understand where we are going and where we are standing right now. So it is important that you go to the doctor, and the doctor will guide you instead of being guided by Google or these kind of presentations. Her friend, a little older than her, has ovarian cancer. She now gets worried. Can she prevent it? Well, an ovarian cancer honestly cannot be prevented, but what it can be done is a regular health checkup, by which it can be picked up at a very early stage. So, even so, our oncologist friends say that you all you all kind of control conditions, but we are the ones who cure a condition. So cancer is definitely curable. A lot of cancers is curable right now, provided it's picked up at the right time. So if it is picked up at the right time, then you save a lot of troubles for yourself. Also, the survival is almost guaranteed. So if she is worried about ovarian cancer, she should just go on getting her checkups regularly, and any new symptom in her body, like if she feels that she's having a lot of acidity suddenly, or if she feels that she's suddenly changed her colonic habits, like she was having regular bowels, suddenly she's feeling like she's having diarrhea, or she's very constipated. So these sudden kind of changes, her periods were absolutely bang normal, suddenly she has heavy periods, or suddenly she feels very bloated. So these are the signs. Any new symptom in her body should not be ignored, and it should be checked by a doctor. So prevention of an ovarian cancer is honestly not possible. A healthy prevention, if you talk about prevention, then it goes early in life in the form of a healthy diet, non-fertility treatment. So these are kind of triggers. So unhealthy diet, a long-term fertility treatment with those hormonal injections, and irregular periods, as well as not on any hormonal contraception. These are four risk factors which for ovarian cancer. In fact, oral contraceptive pills actually prevent an ovarian cancer. If somebody takes an oral contraceptive pill for 5 years, then their prevention is almost 50%. So if you want to prevent it right now, Janvi can't, but Mamta can, and sometimes even Neha can. So even we talked about Suman in the beginning. So Suman also can, by if her parents are aware and if she is used to a healthy diet from the very beginning, that also is prevented towards a lot of cancers. She now thinks of cervical vaccination. Can she go ahead? What is cervical vaccination? It's a vaccination against cervical cancer. It's a very, very well known vaccination, and it should be ideally taken before one gets sexually active. So our little girls, before they become like before they turn 15 or before they actually go into college at 18, it's a good idea to give them. Janvi at 42, she's not going to gain much out of cervical vaccinations, because her the cause of cervical vaccination is a virus, and that virus she has already been exposed to. So it is not that she will have okay, so it's not going to help her much now. But of course, it is a good idea to think, if Janvi has a daughter, so she should think about vaccinating her daughter. Minakshi, 50 years of age, homemaker, both children have grown up on their own. Husband is a very busy person at work. Menstrual cycles have stopped about a year back. Of late, she's not feeling very well and comfortable. What can be the reason of feeling low and having strange symptoms? Menopause. Menopause, if you see the picture, every cell of the body can be sort of sensitive towards menopause. And so menopause can cause these kind of symptoms. They can have hot flushes, they can have physical symptoms like hot flushes, headaches, the teeth getting a little loose and gums receding, hair becomes thinner, breasts drop and flatten. So these are kind of things which can happen physically, and as one grows towards like many more years, the farther they go from the age of menopause, the more problems, these kind of physical problems come out. But the psychological feeling of feeling low and feeling fatigued and feeling a little bit of guilty things, so that those are the things which are very typical of a few years after menopause, and then around the perimenopause, even before you actually hit into menopause. So these are 4 5 years of these kind of struggles, and then the body gets used to it. So how can she manage them? Lifestyle. Again, I'm going on emphasizing on lifestyle. It's a very important that walking, having the right kind of food, maybe cutting down her calories by about 200 calories a day, and going for regular walks, developing or cultivating their hobbies like this that you are doing. There things. So living for themselves is a big thing that she should concentrate now. Meenakshi should concentrate more on living for herself. She has all her life lived for others, so now she should live for herself, and that itself will take care of a lot of psychological symptoms that goes around the menopause. How does she take care of her health in future, especially bone health? As I said, walking, taking calcium about 6 to 9 months a year, doesn't need to take throughout the year, 6 to 9 months a year of calcium, getting a bone mineral density. So it comes in a health checkup that one should do annually. So bone mineral density will tell us how much of calcium does she have in her bones. If it is very low, then she supplements it with higher calcium. If it is okay, then she strengthens it with weight bearing exercises. The best one of those best exercises is walking. So at around her age, a good idea of exercise is to do about a combination of aerobics and a combination of resistant training. So you should work on the muscles. You should not, it's not that you have to make those muscles and make like Serena Williams, but you should make them toned so that you don't have a flab, because the flab is what going to give you more risk of heart disease and brain problems. So you should avoid a flab and make it a little more toned by the resistance training. Remember, the joints, the muscles, they are all very they are now going through a wear and tear. So you cannot do high intensity exercises right now to begin with. To start with, start slow, and then you decide your own limit of exercises. Anything, any combination of concentrating on the muscles and aerobics is good enough. What doesn't work is bursts. So if you go in for an exercise, if you join a gym, go in for an exercise, and then 3 months later you kind of forget about it, then it doesn't really work. Does she need a mammography? Yes, she needs a mammography. After 42 or 45, one should go in for a mammography. If not every year, it should be after every 2 years. And a self-examination of the breast should be continued for every month. So after menopause, it's the first Sunday of every month. Before menopause, between 40 to 50, one should choose the first Sunday after every periods. Self-examination, there are many YouTube videos on self-examination of the breast. Please go through them, and please, like Meenakshi, you should always do a breast examination and do a mammography. She has some fibroids in the uterus. Does she have to bother? If the fibroids are small, or if the fibroids are less than 5 centimeter in size and it's not given her any trouble, she really need not bother about them. If they are more than 5 centimeter, they should keep she should keep a check on them. If the fibroids are seen to be growing or not seem to be shrinking after about 2-3 years of menopause, then they need to be addressed. Vandana, 60 years, retired, keeps herself busy with gardening and music, enjoys travel with her retired husband. Few problems bothers her significantly sometimes. She finds it difficult to hold urine at times. Also, sometimes she leaks while laughing aloud. Can anything be done? Well, at Vandana's age, it's very difficult to do something because the muscle toning has already been damaged. So there's nothing beyond like the usual lifestyle thing that she could have done. She could have definitely done it if she was aware at 40 years of age and start to tone her muscles in the pelvic floor. So there are toning, there are again specific exercises to tone the pelvic floor muscles. One should do it immediately after a childbirth, like not immediately, like soon after the childbirth, and definitely after 40. If there are medications to deal with these kind of things, if she doesn't take if she doesn't improve with medication, there are surgical things also that can be done, but she definitely can do something about it. Often she has bothersome itching in her private parts. Again, there are, it's a very common thing around that age because the hormones are kind of yes, I know, time. The hormones are kind of drying. So if there is,
Dr. Ray, what I was saying is if we could just end this session at a point where you're comfortable and join back
yes,
again,
so
because
this is
it's
my
very,
last
very
slide.
important. Oh, okay, fine, fine, sure.
Yes. So so does see, so this is again a common problem because the hormones are, that area is completely dry and the area is completely devoid of the support of hormones. She needs to go to the doctor and then take a very, very local, most of the times she will just need a local thing, local creams to get rid of it. Mostly not, but sometimes she feels like having sex but feels very dry. Again, lubricants, talk to your doctor. Vaginal lubricants and also some kind of hormonal creams also help in this. What does she have to be mindful of her about her health? At 60, she still needs to take care a lot. Again, diet, lifestyle, exercise. joy, happiness, and regular health checkups. So, so let's pledge, as Barna said, that we have to anyways wind up. So let's pledge, let's spread the good words that we spoke about. Take the proactive steps. Even if you have picked up one new thing from my session, please practice it and take care of ourselves. Thank you very much.